are coming in here. Okay, so now we can see how the fast freezing is working. It actually suctions. So most people just all the way out. This is unusual. But you see how it all suctions in here, and right now all her fat is being frozen there. The little tiny bit that she has is getting suctioned and worked on. Can you all hear me? Awesome. Awesome. So we are going to start the IPL. You ready? Okay. Oh, he's over here. So I just want to show everybody that we have the UV light. That we have the UV light right over here to protect us even more. And now we're going to just clean your face and get you started. Woo!
I'm excited.
Exciting. And you're going to ask, if anybody's asking any questions, this is a good time to ask it.
So what's the downtime, Onir?
So downtime, that's a good question. So downtime with IPL, yes. Absolutely nothing. You leave here and you already see yourself a little paler. I hope you all can hear me. It's, over time you get more and more, you get rid of any hyperpigmentation as the time goes. But you already see the difference almost immediately, and that's what's so beautiful. Everything I do is instant gratification.
My sunless tanner coming off right there.
Yeah. Cleaning off her skin from any kind of, well, she had some numbing medication on, so we're cleaning her off and making sure that I can get the highest, the most effects that I can get.
This feels so funny. It's okay. Like not what I thought it would be.
No?
Yeah, it's so gentle.
All right, so we're going to cover her eyes.
Let me put my hands up.
Let's put your head forward a little bit. Yep, and put your head back. Hold on. Are we good?
Perfect.
Okay. You're going to need bottle.
Is this a good look for me, Dr. Onir?
Oh, there is no bad look for you. Everything is a good look for you.
There's a question coming in.
Yes.
For airline travel, it says, can I still receive this package even if my appointment is in November?
Yes. This package is good until December 31st.
I have to put the deposit today.
You just need to put the deposit today. Is that good? All right. We're going the lowest. All right. Are we ready?
Yes, we are.
Okay. We're going to need, I need to stretch it so it doesn't hurt your eyes a little bit. Okay. You have your, okay. Is everybody ready? Oh, wait. Hold on. It's all live. I need to put the gel on. Gotta put the gel on. I know you're hearing it's the gel coming out of them. Okay, ready?
This is why you wear sunscreen.
Yeah. Well, your generation kind of wore sunscreen, unlike mine. That put on baby oil.
I put on baby oil. I did.
You must have had older siblings.
I had Italian parents.
Oh, there you go. Nice and tan.
Mhm.
We're gonna get you started. Ready? How is that?
Perfect.
So with the numbing, you really don't feel too much of this. And that's the idea with this is that you really, it's the rapid restore. It all goes very, very fast. 1 hour. The whole thing is done in 1 hour. Look at you, you're not even budging, nothing.
I can't feel anything.
Seriously?
Yeah.
All right, then I'm gonna make it a little higher. What is he asking? Make it louder? Okay. I am making it louder. I'm gonna actually make this a little bit higher. That's a good question. It works. Can you hear me? It works if your skin is not very dark, dark, dark. So skin type 1, 2, 3 works great. Once you get into skin type 4 and 5, not so much. So you really need to get a good skin type to see which one. So that's not an answer I can say it works for everyone. It really depends. Okay, that's the one thing that I can't tell you that works for everyone. We need to know what your heritage is, and there's some information that you'll need to fill out. Can they hear me? Did they get the information? How's this a little?
It's fine.
Yeah? We're going to get the great results. You know what I mean? How long are we into it? Oh, you're over here half an hour? Yeah, you'll be fine. By the time I'm done with the IDL, she'll be done with the extraction. Is it too much? I can see you. The higher I go, the better the result. Nice. All right, put your tongue over your lower teeth. Nice. Just to stretch the skin as much as you can. Oops, sorry. Should I lower it?
Maybe a little.
Okay.
Only because I can smell my skin burn.
It wasn't that high. I wasn't pushing it too much. Put your teeth when you come over your upper. Yeah. Really want this under the eyes is like great for like fine wrinkles. Can you hear me? So under the eyes, I love doing this for hyperpigmentation. Obviously, the areas I'm going right now, but under the eyes, it's just the perfect way to battle fine wrinkles. How are we doing? All right.
Fine.
Not very often that people got to watch this live on someone else. A little sensitive. You doing okay?
I'm fine.
She's great, lady. Rapid restore.
Woo!
Is there an area that bothers you more than other areas? Just so I know if there's somewhere for me to
I
hit.
think that you did my chin, and that's really where
That's
it
right.
bothers
Okay.
me.
Good.
Yeah.
Then
You did
let's
a lot
hit
there.
that a little bit more. That's right number.
Perfect.
Great number.
Woo.
Nice. Okay, so what I'm going to do is I'm going to clean your skin.
Okay.
And then when we're done cleaning your skin, it's gonna be time for
Injections.
the injections. Any more questions coming in?
Does IPL have a lot of downtime?
IPL has no downtime. It is not fractal. It's not fractional. There's no downtime with IPL, and that's why we say it's not a laser. It's intense pulse light. It works like a laser, but you need to do it in a series. So it's great if you've been doing IPL, or if you've been doing IPL, or if you've been doing microneedling or Morpheus, then doing IPL once a year, one session is fabulous. But for someone who does it for the very first time, you want to do a series of 3. And it works it's like minimally invasive, but the results are there. I don't know if you can see it, but I bet you when I show you the mirror, you're going to be able to see how your skin just looks lighter.
Probably.
Yep.
So about how far apart in a series, Dr. Onir? So if I have to do a
So
series
you want
of 3.
to do it about a month apart.
Okay.
A month apart. The fall is a great time, and that's why we included it in this. The fall is a great time to do it after the summer. Really clean your skin. Can you all see the difference? I mean, can you see that? You can see the difference.
I can see it.
It's pretty amazing how fast it works and how it's good stuff. I'm going to show you the mirror. Okay, it's very light and bright in the room, so I'm going to just lower the light a little bit.
Okay.
Just so it doesn't hurt your eyes. All right, ready? All right, put your head forward. Are you ready to see? Yep, take that. Oops, sorry. There we go. And a little bit of makeup here. We'll see makeup. But do you see how your skin looks?
Oh, I
so
love
much
that.
lighter?
Yeah.
It just, you can see it pretty instantaneous.
Okay, I'm done this night. It's fine, I'm getting away.
Okay. Do you see
Okay.
how it's
Yeah, no, it looks
already?
awesome.
And it wasn't very painful or.
No, all it looked like, so it looks just like I was getting my picture taken with my eyes closed.
All right, let me get the roller. Can we get the roller? All right, we're gonna get the roller, and we're gonna move on to the next part, which is gonna be the bachelor lineup. We're gonna get you the roller. Thank you so much. Are you ready?
I'm ready, babe.
Let's do the. So what I'm gonna show is, can you squint for me?
Squint?
Squint, yeah, get angry. We're gonna treat these lines with Geomet. Now raise your eyebrows. We're gonna treat these lines and smile for me. She doesn't have too much, but we'll treat these two. Okay? And if she was like 10 years older, then we would start doing the neck. Or if she had a very smile that gums, you can see the gums. If it's her, you can't see the gums.
Really get in
Yeah, this is a good touch part too. Good. See, we have a lot of fun.
We
with
do.
this. We sure do. Okay, so go ahead and roll this back and forth again. Ready?
I'm ready. This
Okay.
is my favorite part of my rapid resource.
Keep going, keep going, keep going. Yes. What area can be impacted? Okay. That's a great question. I'm sorry, I need to yell over this machine. So the areas that get injected, hold on, let's move this. It's right over here. Let's show them. So we got the 11s, raise your eyebrows, the forehead line, the lines over here, that's the crow's feet. You can have it injected if you have a very gummy smile, which she doesn't. Right over here, that helps with that. Some people who want a narrower jaw, she does not want, but this would be a good area. And then finally in the neck, for someone who's a little bit older, like me, that's like fabulous. Did they hear it?
Yes.
Awesome. Okay, so let's get started. But,
This is what?
as we, sorry, back and forth like that.
Okay.
Does everyone see my beautiful necklace? The not necklace,
And bracelet.
the bracelet. CFC bracelet.
I love that.
You're getting this year.
I am. I'm so excited.
Yeah. Why did I just say? Just, okay. All right, so right here. Oh, it's okay. You don't like it.
You can pretend.
It's okay. All right, right.
can pretend.
Right, okay. Hold on. All right, so I like to use my vibrator, as you all know. So right over here, a little out. And we're gonna just put that. How are we doing?
Feels like home.
The braid. Okay. Little out. Anyone going to that chat room? All right, here we go. It helps with the, so the vibrator is a great way to help kind of divert your thinking about a needle going into your face. So people love it. It's just, many people that I inject say to me, did you just inject me? And yes, I did just inject you. So it's just a wonderful thing to use to make it just a little more comfortable. Wait till I go. Here, another little, go back to right there. Oh, where we want to do the size here?
Yeah, I already did that. Yep.
Right, and then keep this back on the other side. And this helps cool it down, makes it more comfortable now that it's cooled down, and helps with the, right away starts to undo the bruising. Okay, sorry about that.
That was my fault. It wasn't because it hurt.
Good. All right. Let's move on to the filler.
The patient asked, how long the results come in, how long the results for Botox?
For Botox, okay, so we're going to shut down. Hold on 1 second so we can all hear each other because you've been with this for 45 minutes. That's pretty good.
Yep.
All right, we're going to stop this machine.
Cool.
Wow, we can hear each other. Okay, let's get this off of
You can
you.
leave.
That's okay.
Mmm, delicious.
Delicious. All righty.
My sunless tanner is going to be all over this.
See, it's over very fast. Okay. We're going to clean you up a little bit, and then we're
My
going to go
sunless
to
tanner.
the... Wait, don't put your little thing.
Yeah,
Okay.
zoom in. Everyone should see their manager like this.
Okay.
Oh, that feels so funny.
But if I had a stomach like that, I'd want it to be seen like that too. That's for sure.
stripes like a zebra.
Yeah. You see that the suctioning over here turns it just a little bit blue. So it does get bruised for a little bit, but of course that goes away. And what's left is a beautiful,
Just a big
less
hit.
fatty area. Okay. Does that feel good?
Perfect. Thank you.
Okay.
All right,
Put
Mom.
the pants back on.
Again,
Pants
something you
back
never
on.
wanted to tell your manager.
Put the pants back on. All right. What was the question?
The question was, how
yeah.
long it takes to efficiently see results?
Okay, great. So with the fat freezing, it takes a couple of weeks. So it takes almost a month for you to excrete completely all those dead fat cells. So that's why you want to do it. If you're going to do it in a series, for some people, they just need just that like little pouch after the summer or before the summer. But for most people, they do it in a series of 3. So you want to do it 1 month apart because that's when you cleared out your system and you're ready for another series. IPL is the same kind of thing. It takes like a full month to see those fabulous results. So you want to come back a month later to really get yourself cleaned up again. With the Botox, you're going to see it, or Xeomin, Jeuveau, or Dysport. All 4 of them are approved in the United States. You see their results in just about 2 weeks. With Xeomin, the reason we love it so much, 4 days. In 4 days, even tonight, you're going to start seeing that that your muscle movement is not exactly the same. So that takes just like I said, it takes like 4 days, 2 weeks max is full results. Fillers is another thing that comes with this beautiful package, the Rapid Restore package, which you can only purchase tonight at this price. So that takes, that's instant gratification. And I'm going to show you what we're going to do tonight with the filler. That's the last bit that's left to do with this 1 hour Rapid Restore. We're only into this about, half an hour, 40 minutes, and she's almost done. So that's how beautiful this thing works. I mean, it works. It works.
This is awesome.
So what we're going to do is we're going to get your lips just a little bit numb, okay?
Perfect.
So I had the advantage of seeing this patient before, and I want you to take a look at her beautiful face and see where we're going to go. So you see how, I mean, she's young and beautiful. Look at those beautiful tear troughs. They just go all the way around, and it's just perfect here. Here, she's just, it needs like a little touch. I bet you she sleeps mostly on this side. So we got to move whoever is here to the other side. Okay, so we need to do just a little bit over here to just raise it up a little bit. And that's pretty much it. I mean, everything else is perfect. Her nose is perfect. Her tear troughs are perfect. But she wants a little bit of lips. So we're going to do a tiny little bit of lips. She doesn't want like big lips that do not match her. So we're going to use the rest of it. What I'm going to do is I'm going to do little injections in her mouth to really numb her up, her lips up. Okay, and that's the advantage of doing this with a doctor versus a nurse in the state of Massachusetts, although there are some fabulous nurse injectors.
There are.
Yeah. All right, ready? So I'm just gonna numb you up with a little, open up for me a little bit. So a little spray right there. And the little, I know it doesn't taste the best, but not so bad. Okay. And we're gonna get you just a little numb. Open for you. And it feels like a dental injection, so a little out there. Sorry about that. Okay, and another little one. She's a full trooper. Not everyone's like this. Okay, ready? A little out. Shake it up a little bit. Hope you're not drinking tonight because you're going to be nice and numb.
I am.
No, this does an hour or so. She's not going to be numb anymore. This is going to help her get just a little bit number so I can do just a nicer job with her lips. Okay.
The question come in,
Yeah.
how long do your results typically last for?
How long what?
Do your results typically last for?
Oh, okay, good. So fat freezing results last for a lifetime. That fat is never coming back. So if you were to gain some weight, the fat cells you have will just expand. But once you do it, it's gone for life. That's pretty good. IPL is another thing. That's for life. Microscopically, your face is always going to look, 2-3 months younger. So that's why we say do it in a series of 3 the first time. And then yearly, you can come in for like 1 or 2 series. So if you do IPL today, when we look at your skin in 7 years, and these studies have been done, your skin looks actually 10 years younger. So in fact, your skin microscopically looks as if it was 2017. Okay, so whatever you were at the age of 2017, that's how far back, and that's every time you do the IPL. So think about it. In 7 years, your skin microscopically is going to look 10 years younger, which means 3 years younger than your skin looks like today. Every time you do this, so it lasts a pretty long time. Botox, Xeomin, Dysport, Jeuveau, all 4 of them, the botulinums, they last about 3 months. That's all they last. That's all FDA is approved for, 3 months. But if you get it continuously, meaning you get it every year and you start kind of young, then you're going to see that you can do that maybe every 4 months or every 5 months. Some people have been coming twice a year. So if you're in your 20s and 30s, twice a year is enough if you started young. As you get older, it's the skin. The skin is not exactly the same, so you start to need it a little bit more frequently. But most patients that have been with me for years, they come at the most 3 times a year, because if you do it frequently enough, it lasts a very long time. Fillers is another. Fillers, how long do they last? So it really depends on where you're putting the filler. So the temples, it lasts pretty long, about a year. Okay, so about 6 months, you're going to want a little touch up the temples and the cheeks, because you smile and you move those muscles quite a bit. Under the temples is a muscle called the temporalis muscle. Every time you chew, it moves there. So more movement means that it's going to move the material, so it's not going to last as long. Tear troughs last about 2 years. And the reason for that is because we naturally produce a lot of hyaluronic acid, which is what this material is, in the tear trough region. So that lasts a very, very long time, and that's why people love it. Nose is another area that it lasts a very, very long time. Reason being, there's not a lot of movement there. I mean, unless you're blowing your nose all day long, it's going to last a long time. Upper lip is another area. I'm starting to get a little numb.
It's so numb, and I feel like my lip is probably.
Yeah, like a big. No, it's not. Upper lip lasts a very, very long time, well over a year, probably even 2 years. Lower lip a little less. So the idea is to get yourself to a stage where you just love how you look, and you come, maybe twice a year, and you just do bloop, 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 just a tiny little bit.
Like a refresh.
And you just say, just like a rapid restore. You come once a year, every other year, and that's all you need. And that's the beauty.
It feels so weird to have my top lip this numb.
All right, so where do we start? Do we start with the lip, or do we start with let's start with the temples a little bit.
Okay.
Can I do this one? Do you want me to do it with a vibrator or no?
Yeah, I'd rather not, but if you want to, you can.
No, it's fine. All right, so let's get her. Where's your icing, your roller?
Right here, I can see
so
it.
let's do.
Sorry for mess.
Let's do this right there.
Okay.
Let's ice that right there. Good questions from the audience. I love it. Good questions. All right. And watch how beautifully this works. A little ouch. Yes.
A question coming from a patient. They want to do filler treatment, but they're not sure which types of filler they want.
That is something that we can discuss. So look at how many fillers you have. And And this is just a few of them that we pulled together. So it's something that we will discuss together at the time of your visit. Because every filler is good. Not every filler is good for every area. You kind of want, I'm just going to touch it just a tiny little bit here. Every filler is good for one area, or more than one area, but not every filler is good for everything. So you want to be very specific at which filler for which area. Okay, so just like a tiny little bit there. And look what that did for her. It just totally pulled her up from here. She didn't have a lot of nasolabial folds, but I mean, she's
If you can
gorgeous like
fix them,
this.
go for it.
That looks beautiful. I'm just gonna go just a tiny little bit in that teardrop. Because now with no mask, no makeup, I can see just a tiny little bit. Normally teardrops I go with a cannula, but this is again just like a tiny. Look at the difference. Look at the difference what that did. Just like it was the tiniest little. But you see how like that's more congruent? Mm-hmm. Just like there wasn't anything wrong with it, but it was just that.
I love it.
Right. But I want you to love it.
Best injector. Most loved injector, actually. I think that was the vote.
Okay. Now let's go with your lip.
It feels Kardashian-like already from that.
It just feels it, but it's not. Which is going to make this injection so much easier. Ready? Mm-hmm. Open feet. How are we doing? Okay.
Oh, fine.
Good. I don't know. Actually, can you turn on the light a little bit now that you're more comfortable with it? Thank you. Just a little bit easier. And again, we're not, there is to do just a tiny little bit. Look at how beautiful that looks. So what I'm doing is I'm just giving myself some room, but you can see she's not even flinching. She's not.
Okay.
Beautiful. That looks so pretty. It's just enough that it's just enough.
I'm so happy.
Right, I'm not done yet. I'm not done yet. You're not finished yet, lady. And look at that. We are only about, 40 minutes into this thing, 45 minutes. And we are just about rapidly restored.
We are.
Okay. You got it? Okay. What we're going to do is just going to lift this here.
I don't feel a thing.
Now I have evidence here that we are injecting you. Mm-hmm. That's for you too. I had to start taking my blood. That looks so good.
I love it.
Listen, when you're beautiful,
That
it's
looks so
easy.
good.
It's easy. So what I'm doing right now is the lip flip. That looks beautiful. So good. Okay, I'm just gonna go on the bottom. Tiny, tiny little bit, okay? Because you okay, close your lips together. You can get that towel to make her,
The lemon color.
yeah, the lavender towel. I didn't want to do it because it was so hot in this one. What do you think? Do you like it?
Onir, I love it.
Okay. 'Cause you don't want any more, right?
No.
This is, yeah. So I got it, what you wanted, right? This is gonna just be a little, like you're gonna feel this one a little bit, okay? So about that. Just to give it a little bit of body on the bottom because you want to match the top. And look how I flipped it. So I decided to put it here and look at that.
Oh, it looks so
Yeah.
good.
It is
That was it.
Rose, that is it. So we have completely rapid restored you. And what took, I don't know, like that. We're gonna put like a nice lavender towel on you. So look what you got. In less than an hour, you got her stomach done. And you can get the thighs or you can get, you know, whatever it is that you want. She got 2 sites of botulinum. This here, she got 2 sites of filler. You ready? She got her IPL and she is completely done. All in a very safe, safe environment. And that's why I'm still keeping this on because I am here with her and she is not covered with a mask. So we need to be completely COVID safe. We've got the UV light that people were asking about. And it all got done in less than an hour. And that's what the Rapid Restore is all about. It's about restoring you at the end of 2020.
It's been a year.
It's been a year. You deserve it. And we at the Spiegel Center decided that what a better way to treat our VIPs than giving them the Rapid Restore at